that we do, not only the work that we. I'm sorry, I think I'm having an echo. Just bear with me 1 second. Testing. Okay, I guess that's much better, and I hope you could all hear me. But I just want to use, I'm muted. I just want to use some of the work that we do to talk about some of the things that could be done in the business continuity space to see how we can develop this some more. I'm muted. I'm still muted. Okay. Testing, testing. I think I'm still muted. Okay, great. Sorry for all the technological hardships, but I guess it works out for us. This is part of the whole idea about doing the business continuity idea. So again, welcome. I want to look at what has happened with COVID and where we are. Again, my name is Killian Songwe. I work with the Global Healthcare Public Foundation. And I always want to do all the things, the presentations that we have, at least I try to do them on a backdrop on the ISO standards. And because the reason why we do this is because we want to be able to ensure that as viewers and as active people who are in business of whatever it is, that we recognize the fact that there is a standard that actually allows us to be able to provide the best services possible to our clients. And in healthcare, this is actually very, very critical. So there are a good number of ISO standards that manage issues around healthcare facilities, healthcare service delivery, healthcare performance. There are accreditation systems to hospital systems, to the different ancillary services that actually exist. But it's most important to realize that in spite of all of those standards, there are also standards to ensure the fact that there is some element of continuity as the healthcare systems actually go on. Because as my topic actually shows, we want to discuss this looking at the pandemic and what the pandemic has done and how we can continue to ensure our services continue to go on. But I want to look at it from an area of my own expertise, which is healthcare, and in particular laboratory sciences. So to be able to bring this home, I really want to talk about something that we've actually done. So I want to look at our own story here at the Global Healthcare Public Foundation. Early February, everybody already knew about the pandemic and what was going on in China. And this is long before it was even declared a pandemic. We had actually begun to look at what we were going to do from our own workforce point. And when we look at the workforce, one of the most important things we're looking at the time was our own workforce protection. We're looking at issues of securities. How do we keep our communications going? How do we maintain our facilities and the kind of IT infrastructure that we're going to need to be able to continue to do business in this period of time? To be able to do that, we also had to look in depth into the communication strategies that we were going to employ, information, education, and communication material that we could distribute, both to our staff and also to the communities that we support. Looking at all the hospitals and laboratories that we support around the country and the partners with which we work with. So we needed to come up with material that we could share with them. And that's why I talk about internal IEC material as well as external IEC material. But then there was also issues of security that we needed to communicate, our premises, the work that we do, interested parties, how the interested parties continue to stay in touch with us in spite of the things that we were projecting that was going to be coming along. Then, of course, we had the customer-client engagement. We had to be able to keep the facilities that we work with in constant communication as to what were the projections like, what were we looking forward to. When we looked at what was going on in Asia and going on into Europe and the response that these countries were having, we actually were looking at what would we do in the event that as a continent, as a country, as an organization, how do we continue to keep our business going? And how do we ensure that our clients continue to get the kind of service that they deserve to have? And this is important because we were able to do this ahead of the pandemic actually being declared and ahead of the pandemic actually getting to our offices, we're able to do some very interesting things. Financial stress. Financial stress was actually one of the really important parts that we had to work with because doing the kind of work that we do as a project, it was really crucial that we are able to locate how we're going to continue to do our financing, but most importantly, how we could continue to support the activities that we're doing in the field and make it much more useful to be able to address two things at the same time. Address the pandemic, yet continue to support the work that we're doing. From a logistics point of view, ensuring that we had the right liquidity, not knowing what was going to happen to the banks, just doing our financial analysis, making sure that our burn rates were where they needed to be, and those kinds of things. Then from a management point, ensuring that all of these four pillars were actually working. There was coordination and response. There were scenario plays that we actually had to put into place just to be able to see how these things would actually come to bear. Some very simple yet very tough decisions that we had to make. For example, we had to decide on when. And that's a very simple thing, when. But as an organization, we made a decision that one of two things were going to happen. Either there was going to be a directive from government, in this case, presidential directive, or there was going to be a number of cases which we were going to now activate our business continuity plan into. So that decision actually made it very clear to us when do we go into emergency mode and how do we operate in emergency mode. In our case, we never saw the 100 cases. We actually had a presidential directive which we abided to. And then how did we actually go on to conduct business? Instantly, because we had already had the planning in place, our IT systems were already in gear. Now we could actually work with our different teams, all working from home, from all parts of the country. We had things that we could benchmark against. We're also able to continue to support the Ministry of Health, all our facilities that were out. But what was also important to us was to ensure the fact that we could manage the burn rate. Because now what we were seeing was we had our staff on multiple calls, doing multiple events. They were sustaining what needed to be done at office. They had to sustain facilities out there. And multiple things were happening at the same time. And then our first challenge was actually ensuring that we were able to get salaries out on time in a system where there was a complete lockdown, how we could manage to ensure that the motivation factor, as it has come to be known in this part of the world, the vitamin M for money, could actually reach the staff in a good enough time to be able to keep the motivation going and to be able to support some of the things that we were doing. And I throw in this, this is actually something that is actually happening as I speak. This is an assessment done by the South African National Accreditation System. But we were only able to make these kinds of things happen because of a lot of preparation to continue to do the work that we are known to do in terms of time when there was a complete lockdown. The South African National Accreditation System put into place a no travel ban on all their staff. And this has actually created a huge challenge for a lot of medical laboratories that are either in a surveillance period of the accreditation system or doing their initial accreditation assessment or doing their annual accreditation assessment. But for us, it wasn't a problem because we had already made the plans. We developed a platform. We were able to get a platform in place which we could use to train our facilities, which we could get our interested parties on board. And with that, we've been able to continue to do work almost seamlessly. I'm not going to say seamlessly. We've had some very interesting challenges with internet access at some of our facilities. We've had some of our assessments or audits last a little longer than we would have liked for them to do. But this is our story, and this story is actually based on how did we use the international standards that are available to continue to do our own work in a field that has absolutely nothing to do with business continuity in the case of healthcare. So just looking at this, because there is a backbone to almost all the international standards, that's the ISO 9001, which is a quality systems backbone standard. Basically allows you to determine risk, look at your priorities, look at the things that are going on in your workforce, and how do you set up an infrastructure that allows you to continue to carry out the activities. When we put that against the standard for business continuity and management systems, basically what we are looking at is, why do you want to do business continuity? You want to ensure that your services continue to go on. Is there a return on investment for investing in something like BCA? That is really important, depending on what the service that you're providing. In our case, in healthcare, our service is crucial. So business continuity is paramount. You have to make sure that the clients and the patients and the people who use the services actually continue to have access, and do the best that you can do to make sure that it is seamless. So top management support is very crucial in this kind of activity. I think one of the most important things about putting this together is actually the plan, do, check, and act, adjust. Everybody who's done project management says plan, do, check, and act. But because we've done it as often as we've done it, we've decided to change the act into adjust, because we're actually adjusting on things that we've checked and things that we know how to perform. And we try to make them better by making these kinds of adjustments. So, but when you look at the 22,301 and the 9,001 standards, you actually see that they actually belong to the same structure of high-level structured standards, which actually makes it easier for an organization like ours, which is 9001 certified, to be able to do this kind of thinking and preparation seamlessly. So how does it work? Three simple steps to making sure that you continue to provide service in a seamless way. The first one is strategy. What's the policy you have in place for your business continuity plan to continue to go on? There needs to be a strategy in place that addresses the product and the service that you're going to provide. So that, as you could see from our earlier slides, we're able to come up with that policy because we're looking way ahead, and I'm talking about February of 2020. Then there needs to be a tactical process in place, and this is where the management actually comes in, and we're looking at what are the activities that are actually going to happen for us to continue to do what we're doing. When you're talking about healthcare, this is highly scientific, and so there is a need for a lot of precision in the work that you're going to do. There's a need for sequencing, ensuring what comes first, how does it come, how is it going to be delivered, do we have the right infrastructures to be able to deliver the material that we want to deliver in the way we're going to deliver it. So that tactical process is very important, and every business is going to have to look at it from their different microscopes and different lenses. Then there is actually the operationalizing of the policy and the technical know-how, which are the actual activities that actually go into play, and how those different activities, when they go into play, how they're actually going to be rolled out. I must say from our point here that I think the only challenge we had was the element of time. When you do this the way we did it, yeah, there is a little bit more investment in time. But that investment in time, when you think about it, is investment in time well spent, because yes, if we went out to do a coaching assignment, most probably you would do a coaching assignment over an 8-hour day, and you would actually achieve a lot more. But now if you're going to do it online, every hour and a half, you have to take about a half-hour break just to be able to make sure that everybody is comfortable. Then you have to break for tea breaks, and then you have to break for lunch. There are all those breaks that you have to put in. So a traditional 8-hour day might most probably be a 16-hour online activity. But that's how it's going to have to happen. You have to think about it from the operational point and be able to do it. There needs to be a team that is going to be involved in doing this. And from when you look at the team and there are different levels of strategy in trying to put the team into place, the very first thing in ensuring that we were able to deliver and continue to doing the work that we do was just looking at the scope. What was it that we wanted to achieve under the circumstances? So we literally identified really two very important things. One, we wanted to keep our labs, all our different laboratories in a position where they could continue to offer quality and reliable service to the clients. And also we wanted to be in a position where we would support the Ministry of Health. At the time, the biggest instrument that was going around the world were infrared guns to be able to take temperatures for people. And that was a very important thing for us to be able to see how we could support the Ministry of Health, get calibration material into the country in a time when shipping and clearing was such a difficult exercise to do, but be able to get those calibration guns in to be able to calibrate the infrared guns to be able to take temperatures of people, ensure that pipettes that are used for testing are as well calibrated, but setting up that clear scope that allowed us to be able to move on. What does that bring with it? It comes with a crisis management team from a technical point where we needed to look at what is the kind of budget that needs to be assigned to this kind of activity and who needs to actually be responsible at the same time. Then you move on to strategy level 2, basically. In strategy level 2, actually, basically at this point, we're looking at what is the analysis and the impact of the analysis here. You move from administrators and business continuity sponsors to the crisis management team. Literally, you shift management into the next level of managers down. So people actually identify the different kinds of services, dependencies, and what is actually critical to be able to move on. And you use your department heads at the same time to identify what are the key functions and activities that must be realized to be successful. This is key because when you look at what I'm talking about, I'm actually doing a presentation of, first and foremost, there is a clear scope. Yes, you're an organization and there are multiple things you do. You could be running a research, you could be taking care of patients. There are many things you could be doing in the healthcare system, but you need to be able to say, what are we going to focus on? What is that one thing that as an institution we're going to be dependent on? Then creating a business continuity plan, creating a crisis management plan that goes between the crisis management team, the department heads, and testing and exercising of that plan becomes really crucial in ensuring that the system is actually going to work and then you're going to be able to deliver it. All of this, we actually had to, this was one of our many scenarios that we had to play out at the Global Healthcare Public Foundation to be able to ensure that we could continue to do the kind of, give the kind of service that we gave during the pandemic and in a total lockdown situation and post the crisis of the lockdown. We still have a ban on travel, but we're still able to continue to do the kind of work. So when you look at the impact analysis on the services, basically what are we looking at? We're looking at the processes, the process of analyzing activities and the effect that a business disruption might have on them. And from that point, what is our key objective? Our key objective, identification of business functions and services. What was the key service that a global healthcare had to provide to its laboratories to be able to ensure that they could also in turn satisfy the clients? Because again, at this point, not everybody was seeking healthcare. Really the sick, the very sick were the ones seeking healthcare. And it would have been extremely painful to have them come to a facility and not be able to get the kind of healthcare that they needed, either because staff were not available, there was no transport, or there were no testing requirements. That was key. Recovery objectives with justification. How do you ensure that, yes, there were some staff that had to work multiple hours because they could not be replaced or some other people could not come in to be able to release them of their functions. Those things had to be taken into consideration. Analysis and tools that were used. Now, this is really important because when you think about it, for you to be able to think about going forward in a crisis, in this case, in a pandemic situation, a risk register, a risk matrix, and risk analysis is a very important aspect of just being in a service providing situation. Always knowing what that risk is, keeping a good register and doing a good analysis of the risk Those are the kinds of things we had to be able to look at and say, what if then? What if the internet systems didn't work? What were we going to do? We did something very simple. We actually just provided to our different facilities modems so that we could still stay in touch with them. It sounds easy to talk about it today that we provided modems, but there was a lot that went into providing the modems. We had to think about the transport system. We had to think about acquiring the modems. Had to think about what service we could use to get the modems to where we needed to get them to, just for us to be able to do our work. And then there is the results, which is crisis communication and the plan around the crisis communication. Those are the kinds of things that we looked at to be able to ensure that we continue to do the business that we do, the way that we do it, with the kinds of achievements that have been achieved. But of course, let me not make this sound that easy. There is, of course, a huge cost associated to all of this. And what was the cost that was associated to all of this? As the pandemic grew and as the lockdown intensified, instantly, if you had not kind of hedged into the market, what you actually ended up finding out was a pair of gloves, which traditionally might have cost you 500 shillings, $10, now started costing you about $25. People were taking advantage of the market and taking advantage of the situation. Now, this was an area where the cost of continuity solutions becomes really important, because when you look at what is the disaster event and how are you going to respond in a disaster, when you put that into play, what you actually are going to be mitigating is you're going to be mitigating the cost of business disruption. In our case, as soon as we saw what was going on, we knew instantly we have people who have to go to the field. And it goes back to what I said in my earlier slide. What was the security of our own staff? The security of our own staff was hinged at 100% on what kind of protective, personal protective gear we could get for them. That was big. Personal PPEs, as everybody knows it, soon became a really big deal, and prices went up. We had enough. We had enough. We could ensure that our people could go into the field. We could even ensure that our people could share this personal protective gear with the people that they were going to work with, so that there was a good area of satisfaction and no fear between our people going in to provide technical know-how and the people who had to receive the technical know-how. So yes, there was a cost element. The new things such as having to have sanitizer became a big thing in the industry. So we had to acquire lots of sanitizers for our people to be able to use, for the people who were working within the facilities to be able to have. That was not part of our regular operations budget. But again, the cost of continuity was actually mitigated by us looking into those kinds of things. Otherwise, we would have been in a total disruptive state. So looking at this, this is a very simple four-step procedure looking at your cost element. Because of course it was business as usual up to the pandemic being declared, and then there was the pandemic. And when you're looking at it from a service providing point, you're looking at what is the duration of time needed to bring critical systems back online. Because imagine in the case of Uganda, where I'm actually speaking from now, the lockdown was declared, and then within another 24 hours there was no movement. So at that point, you needed to start thinking, how do we get all our critical services back online? How do we get our IT person back to where our IT infrastructure actually is based to be able to set up? How do we get our clinical staff back into the hospitals to be able to provide service? I know some clinical people were halfway across the country because it was just about getting to the weekend. People had traveled to see families, but they could not return to their place of work. Then the next thing is a work recovery time. Amount of time required to clear the backlog. Yes, there were still patients to be seen. There was a shortage of staff, but all of those things have to come back on board. And they don't just have to come back on board. We have to be able to treat patients, provide the services. Because again, by the way, lab is the key, is the gateway to providing good quality healthcare for our patients. And then the maximum downtime. What is acceptable as a maximum downtime? We're talking about collecting specimens. We have specimens that we will collect from clients or patients, which can only be kept for 7 days. We have samples that will not go past 24 hours. That maximum downtime became critical in terms of looking at what was the available workforce that you have and how do you provide technical support to that workforce to be able to continue to keep the business going of providing reliable and satisfied results. So when you look at between the breakout of the pandemic and actually looking at the maximum downtime, the huge cost element is what happened within that downtime. In terms of, in the case of the pandemic, there are huge things. We had commodity shortages, we have transport issues, we have availability of work staff. And that maximum downtime is what you're actually looking at in our business to be able to ensure that you can continue to keep the client safe, you can continue to provide reliable services to the clients for them to be able to come back or stay in hospitals if they are actually in hospital. So I threw in the slide because it's really what actually epitomizes the whole continuity of service. Is looking at the management structure from a holistic point of view and identify what are the threats in the system, what could actually create a big impact to your business operations. And I put a couple of things around it. Reliable contingency. Reliable contingency is really important. It doesn't mean that you have to have two of every staff, but it just means that you have to have people who are multidisciplinary. You need to continue evaluating the situation, test arrangements, competent associates in our case, reliable communication. I think reliable communication is the one big take-home thing that going through the pandemic, I would absolutely say was really important in trying to get things done. Incident response. We had different questions, we had different comments from different facilities. And again, some of our facilities are district level, some are below district level. And so their requirements are usually very different. And the response that they will ask is different at different times. But knowing how to be able to give that response, being able to give it in a timely fashion to be able to sustain the laboratory activities to ensure patient care was actually crucial. This is another slide. I threw in some of these slides just to be able to show how this planning continues to help. This is Hoima actually going through an assessment, and one of the big things today is everybody must have a mask, and as they continue to do their work. What was actually important in these pictures was the laboratory was actually using a cell phone on Zoom to be able to relay images and take the assessors through an actual walkthrough of their laboratory. I don't know how many hours we spent into testing this, and how do we make the connection between a cell phone and Zoom, and how do we get somebody to explain what the assessors are going to see, and how do we take the assessors through the showing of the lab and showing them of the entire environment. These are processes that had to be tested. Again, as I spoke about scenario testing, these are processes that had to be tested. We needed to verify them, validate them, be sure that there will be no disruptions in them before we could actually go to the accrediting bodies and say, you know what, we challenge you to challenge us on this exercise. And it's taken us a long way. But this is a very important exercise in terms of ensuring the continuity of the business. But most important, not just ensuring the continuity of the business, but most importantly, ensuring that the patients, the clients to these hospitals continue to have reliable and satisfactory results all the time. But of course, in trying to build all of this, you need to pause, you need to look to the risk assessment, what is going to be involved in ensuring these kinds of things. And basically, the three big steps is identifying all the possible risks that as an institution on both sides, as the service provider and the institution that is receiving our services, identify what are the risks and what are the challenges that we're going to come across, analyze them, try to figure out how we can go around them, do an evaluation. At the point of the evaluation, you literally only have two results. It's going to be something that is acceptable. For us, acceptable meant what is the financial impact and how does it play with the rest of the things that we have to do, or what is completely unacceptable in terms of, do we expose our people? Do we put our people, our staff in harm's way by putting them out there to be able to provide this service. And then once you make that decision, you figure out what the response is to be able to continue to provide the service. So doing the risk assessment is very important in terms of ensuring that you can continue to do the business that you are in and provide the services. I spoke earlier about communication and trying to make sure that you're communicating to a number of people. Yes, our service is to provide technical assistance to the laboratories, but we need supplies. We need the right personal protective gear. We need to have an operation that involves people, the telework. With the vulnerable people involved, we have a workforce of all kinds of people. There is risk involved. Then there is, of course, the logistics. I mentioned that we had to move modems into the field so that we could ensure that we could also work with the people in the field to continue to provide the service. There's a huge logistic effort around that, just ensuring that the internet actually works. And what is the alternative when the internet fails? How long can we wait? And then, of course, there are the clients at the end of the tube. And there needs to be a total communication stream that allows for us to be able to get good feedback and use the feedback to ensure that the delivery of the service can be maintained. This is looking on, there are issues of priorities we needed to think about. What are the priority areas? Safety. Our people were going to be in the field. How could we ascertain that they were going to be able to wash their hands as often as they would have if they were in the office? The alternative to that was just get more sanitizer. Sanitizer, interestingly enough, was not something that had ever made it to our budget line before. But now, because of the pandemic, we had to bring on sanitizers into our budget line, but we didn't only have to bring it into our budget line, we had to be able to look ahead and be able to say, okay, this is something that is going to be on. The price of sanitizer is going to change. The quality of the sanitizer is going to change. And so procurement of a reasonable quantity upfront was also crucial, just to be able to ensure the safety of our staff, protect clients, social distancing, delivery dates. Delivery dates were just all over the place in terms of procurement. For us now, the intent now was how do we communicate between our clients, which are going to be the different laboratories, and our accrediting bodies to be able to tell them, oh, this is the true lead time for us to be able to have our labs ready for you to assess. And what was the reduction in cost for doing this? I must tell you that we actually incurred a huge reduction in cost because for the number of labs that we've presented for accreditation in this period, if we just look at transport for one person, it's about $1,000 times 2 assessors that are needed times 5 labs. That's a good $10,000 that just got saved instantly, and everybody stayed safe and well wherever they went. Then, of course, there is the big element of the infrastructure and communications, the hardware. I spoke about buying modems, software. We all had to take classes on how to use Zoom. We had to appreciate how to do the Google Meet, cloud service. All of those things suddenly came into play, training people to take on new assignments. That was really key because at the end of the day, what we needed to ensure was our laboratory is ready for the accrediting bodies when the accrediting bodies come on. Open new communication channels. That was very important. New communication channels, whether it was Skype, WhatsApp, Zoom. Those were things that traditionally would not have been part of our everyday operation. Yeah, you made a quick phone call, you had a 15-minute conversation with your facility, and that was a good enough thing to plan. But now we were having long hours. Some of these facilities don't have access during the day, so you'll have to wait until late in the evening to be able to get access. There's important things like that, small yet very trivial in terms of being able to provide the kind of service that we do provide. Of course, we had to include customers and in this case, our facilities and our suppliers so that we could actually be able to get a whole 360-degree understanding of what we were trying to do and how do we do it in the best way possible. But what did it mean for us? What did it mean for us at the Global Healthcare? Change in workplace. Change in workplace was really, really important because instantly, we're not just looking at providing PPE to people who are going to the field. Well, our entire workplace itself had to change for us to be able to continue to have the peace of mind that we needed to be able to do the work. We suspended visits and trips, but for us to suspend visits and trips, it meant that we needed to have our people back in our facilities. People had to pick up new competencies. People who normally would never have done procurement had to learn a thing or two about procurement because the procurement people were not here every day. And so we needed to learn how to do some of those kinds of things. Define new actions. Some people never had to use Zoom for any reason. But now they had to learn how to, new trainings had to come on board on how some of these things were going to be done, evaluating effectiveness of the work that was being done, constantly checking with our clients, morning meetings, trying to see where are we today, what has not been done, what was carried over. Literally what happened is you actually removed a lot of the activities that would normally have happened at top management level, and we dropped them 2 levels below, and so that everybody was a part of the decision making, allowing us to be able to make decisions at a faster pace, yet at the same time be able to deliver the services that we needed to the different people. What to communicate, we had to have new rules on our communications. When was this communication going to be made? These were decisions that were made almost every day. To whom did we need to communicate, and how was that communication going to be done? And who communicates what? Of course, we're dealing with multiple partners. We're dealing with government at very senior levels. We're dealing with laboratories at distant places. And so we needed to, who is going to communicate and what is going to be communicated? These were things that actually, for us to be able to stay in business during the pandemic, and as things continue to evolve, all are things that we need to continue to look at. Of course, there is the big element of supplies. Commodities and commodities management continues to be the biggest compensation during this pandemic. But staying in touch with your suppliers, understanding what the delays are, is crucial in terms of maintaining the workforce and in terms of maintaining the services that we have to provide. Look at a list of, just revisit our list of pre-qualified suppliers. That is critical, and this comes back to the issue of contingency from a client's perspective, just ensuring what are the contingencies that are in place and how are those contingencies going to be brought to life, and looking at what are the different delivery lineups that we can actually put in place. Functionality, how to defining roles and responsibilities was just very, very key, because now people were wearing multiple hats. Management just ceased to exist, and everybody now was management. And so defining roles and responsibilities became key. Activation processes, how to manage immediate consequences. Of course, if you ask somebody to go out and buy 20 liters of sanitizer, and at the time when they were getting the quote, a gallon of sanitizer cost you $150. By the time you actually go through the process and actually request for it to be delivered, the price is double. And there are huge consequences to that, to your financial stress margin and being able to deliver the service and ensure that you're delivering it in a safe and comfortable environment. So these were functionalities and things that decisions had to be made in real time, and service had to be delivered. How to continue to reopen priorities, activities, are just looking at, so how do we ensure that we stay and we continue to do the things that we're doing? But also, we had a clear point when we said this goes into effect once the first 100 cases of COVID are identified, or once there's a directive from government. But now we're also beginning to look at, when do we stop? There has to be a clear strategy and a clear trigger to what is the element of stop. So in terms of resilience, one of the things that as the foundation we've built, and one of the things that we would like to share as best practices or lessons learned, was how do you develop cross-functional teams, and how do you use cross-functional teams in times like this? In a lot of our facilities, we're able to give responsibilities to multiple people. We're able to use them in different ways. And that, of course, enhances the cross-functionality of teams. What are the kinds of plans that you want to be able to put in place? How do you want to be able to move the people among the different shifts? Because, yes, a lot of these facilities already work 24/7. But for how long were you going to keep the same person working 24/7 when his colleague was caught up so 200 kilometers away and was not going to be able to make it back for the next 2 months or 3 months? So I just throw in here a bunch of standards that, in spite of the fact that any one of us might think that we are in whatever the business might be, in the case of healthcare, these are standards that are really crucial in continuing to ensure that you're in a good place. Quality systems, information security. A lot of our work has gone into the cloud space, software, occupational health and safety, just ensuring that before the biometric system to get into our workspace was a thumbprint. But of course, when we think about it today and we think about the potential that the virus will be sitting on your thumb, we've moved to card services. So now you just need to flash your card at the biometric and you have access. Auditing management systems, just ensuring that the systems continue to carry out the activities that they need to be able to carry out, business continuity, what we're talking about now. And then, of course, there is a whole standard on risk management, which is crucial to ensuring that the services are provided the same way all the time. What does top management have to do with this? Policies and objectives has to be looked at. Why is it important to communicate and communicate often? Be direct and supportive of staff is very, very crucial in terms of trying to ensure that the services can be provided. And then promote continual improvement. I think that I must say that for us at the Global Healthcare Public Foundation, I think COVID-19 must have been godsend. I think it has been a phenomenal time for us to be able to have continual improvement, innovations, come up with new things that are truly fascinating in their own way, but have allowed us to continue to deliver our service in a very phenomenal way. Again, I hate to come to the end of one of these without continuing to talk about the things that are going to keep us safe. Look out for our temperatures. I did mention that we're very instrumental in trying to ensure that the infrared guns, temperature guns were calibrated. So let's continue to check our temperatures. Or wash our hands 20 seconds or more with soap and running water is very useful. And then, of course, in the absence of water and soap, use the sanitizer and always have a face wear and make sure that your face wear fits properly while you continue to ensure a good, safe distance from each other. At this point, I'm going to pause and take any comments or questions that may exist. If anybody has a comment or questions for me, I'll be very glad to take them at this point. James, James, thanks for this classic presentation. Genuinely, have you done a comprehensive, meta-analysis on business continuity amidst this specific SARS 2 times to universally recommend evidence-based policies for established governments on business continuity? Actually, James, this presentation I'm actually doing from our own work. This is how we got prepared to be able to do the kind of work that we've done this far. This is actually a direct correlation of a number of standards, bringing them into play with what we do and the standards that govern the work that we do in terms of helping clinical laboratories to be able to provide reliable and satisfactory results to clients. So in terms of our analysis, I think first and foremost, as an organization and a standards organization, being able to appreciate what the standards mean and being able to appreciate how they come together in the work that we do, I think is key. In terms of what governments are doing, each government is going to have to treat its population and its nationals and its visitors differently, and they're going to have to respond to the emergencies as it is in their different parts. So you have countries that have tested, done a lot of testing. You have countries that have done no testing, and you have countries that had a total lockdown, and you have countries that had no lockdown at all. This were the different responses to how do they continue to provide a good business system. But I'm just reporting from you in terms of how did we do what we did to be able to continue to almost seamlessly provide the kind of service that we've provided thus far. Any other comments, questions, thoughts? No deletions. I always say no deletions. You can't delete anything I've said. You can only comment on it or you could question it, but you cannot delete it. Okay. All right. I guess this was very technical. We're using our own story, which is healthcare based, not a traditional supermarket story. But again, I think the principles are the same, and you could use the principles in any business. But from a healthcare point, representing the kind of work we do and how useful it is to support the patients out there. It is our hope that you could use this in any part of the healthcare industry, whether you're doing it in any of the ancillary services or you're doing it with your patients or you're actually doing it just to support the hospital as a hospital in terms of its own putting together of infrastructures and how do those infrastructures come to play with all the different activities that have to be done. Okay. Again, if you have any questions, you sure could reach us. We'll be very glad to have this conversation offline with anybody who wants to know what we could do for them to support their labs. That would be a very great idea. I would be very glad to do that with you. Till then, have a wonderful rest of the week and enjoy the great weather. Thank you.